Hi everyone, we're here with our beautiful patient Ishani. Ishani is interested in improving her under eye dark circles, and she's actually requested that as opposed to filler, which is something that actually is a great option, that she wanted to actually utilize her own blood. She had heard about how we perform this procedure, which is called PRP. It stands for platelet-rich plasma, where we actually take the blood, we're able to centrifuge it and separate it, and take the clear component, which is plasma, which is packed with growth factors, platelets, which have granules that really stimulate collagen, stimulate blood flow, and just have a variety of like stem cell-like sort of growth factor properties. She had heard we do that, and we were going to actually show you how we do that. And PRP is something that is really gaining even more popularity. We've been using it a lot for stimulating hair growth. We also use it for improving skin tone. We do use it whether it's post-laser or post-microneedling or radio frequency, where those channels actually absorb the PRP and help stimulate collagen. In this case, we're actually going to take PRP and inject it. It's not that we're going to just basically apply it over skin that's been denuded with laser, but we're going to actually go ahead and inject it. I've actually been pleasantly surprised with the after results. I've seen how forehead creases actually improve. I've seen under eye hollows get better. I've seen lines improve. So in Ishani's case, she's beautiful, but she again was bothered by those hollows. So we're going to go ahead and inject it in her lower eyelids. We're going to just do a little bit in her sort of laugh lines, and we're going to do a little bit in these lines that she has a tiny bit basically coming off the corners of the mouth. We will sort of do a follow-up with this so you can actually see how she's doing in a month or two, and we can sort of hear from her what her experience is, so you can actually get first-hand experience about whether this works or not. So we're going to go ahead and do the procedure. So I just want to show you what the actual solution looks like. You can kind of see it's clear. It's got a cirrus yellow color to it. This is after her blood has actually been separated. This is what we call plasma. It has growth factors, it has vitamins, it has sort of natural platelets, which will release the granules and release growth factors. And we're going to go ahead and just inject them, okay? How are you doing? So she's already been prepped. She's ready to have the injection. If you need a break, just let me know. Okay. All right, so here we go. Little pinches, Ishani. My goal is not to get an immediate filling effect, even though you will see that immediate filling effect. Plasma basically is going to stimulate collagen. And you can kind of see that I'm injecting it. And she's requesting this because she, again, wanted to do something more natural. Fillers, ironically, the ones that we use are made of hyaluronic acid. So those are very commonly actually found in our body. So they are natural source of filling. So there's nothing unnatural about fillers, but she just felt more comfortable to use her own stem cells. So this is one syringe. How did that feel?
It's perfectly okay.
You okay?
Yeah.
All right. Close your eyes. So we're going to go ahead and move to the other eyelid. Don't forget to breathe, okay? Little pinches. So PRP is not something where it gives you an immediate improvement, because it is very, it's really watery, but the goal is to stimulate collagen long term. And I'm just basically injecting it. Now, what is different about this method is, unlike microneedling and then basically applying the liquid, the PRP, over skin that's been microneedled, we're actually injecting this where I want it to go. So I want to really stimulate collagen deep. So I went ahead and just injected it under the skin. She does have this immediate improvement because, again, it's fluid that takes up space, but that PRP is just going to sit there, and over time it induces collagen. And it's not going to happen overnight, but you should, over basically a month or two, see this reduction in the hollowness and certainly in the pigmentation. I've actually treated it for hyperpigmentation as well, and I've seen people with melasma or hyperpigmentation, the PRP, we don't know the mechanism by which it works, but I've seen it actually lessen the dark colors. It improves the darkening of the skin. And again, we'll just show you and you can be the judge of it over time. So next we're gonna just kind of treat her laugh line. She doesn't really have much, but this is something that she would like to reduce. So we're gonna go ahead and feel little pinches. Again, this does give you an immediate fullness, but that is not the goal. The immediate fullness happens to be just because we're injecting this watery PRP substance. But the goal is to stimulate collagen. And this is good for naturally stimulating collagen. I truly feel that this is the future of cosmetic treatments, is utilizing your own powerful blood to regenerate collagen, and we certainly have used it to stimulate hair growth, and we've seen nice results with it. You can kind of see with just obviously this area filled in, but the goal is, and some of that will certainly go down, but it's about really seeing results long term. We're going to move to this side. We're using a tiny little needle to inject. And the injection is kind of done right below the skin into the dermis superficial subcutaneous space, the fatty layer. And again, the plasma is something that just has growth factor properties. It does behave as stem cells. We're going to do a little bit in the corner of the mouth, okay? And we'll be done. You are a great patient. I know it's a bit uncomfortable, but we are using really tiny needles. She's really young and she has beautiful cheeks. She doesn't need anything anywhere else. I'm trying to see if there's anywhere else we can inject this, and I don't see any other place. So I think with this, so I put a syringe in each lower eyelid. I put a syringe in each laugh line, plus we put half of one syringe on each side of these, what we call sort of malolabial folds. And I think that's it. We're done. Very good. So keep an eye for the next video.